Radial wrist pain. Quervain syndrome occurs due to inflammation of the tendons of the abductor pollicis longus and the extensor pollicis brevis. It causes pain and swelling over the thumb side of the wrist and difficulty in gripping. Many activities can lead to Quervain syndrome, including twisting, hammering, skiing, lifting heavy objects. People who cares for babies and young children commonly experience Quervain tenosynovitis due to holding or carrying the child. Finkelstein's test is used to diagnose Quervain syndrome in patients who have wrist pain at the radial side. Finkelstein test is done different ways, but the best way is to ask the patient to make a fist with the fingers closed over the thumb and the wrist is bent towards the little finger. The wrist is then pulled so that the tendons of the first dorsal compartment are stretched distally. That will cause sharp pain and local pain if the tendon inflammation is present. Intersection syndrome, not a very well-known syndrome, but the pain from the intersection syndrome is felt on the top of the forearm where the two muscles that connect the thumb cross over the underlying wrist tendons. These are the two muscles of the thumb, the extensor pollicis brevis and abductor pollicis longus, and they cross over the tendons of the wrist, which are the extensor carpi, radialis longus, and brevis. Many activities will cause intersection syndrome. It will include overuse of the wrist and hand, grasping, turning, twisting. Please note that the pain and the tenderness is more proximal than Quervain syndrome. Dorsal wrist pain. Anatomy. There are 6 compartments in the wrist, dorsally. Ganglion cyst most commonly occur on the back of the hand at the wrist joint. Usually, a small ganglia is painful. The ganglia may arise from the wrist joint itself or from the sheath of the tendon. Extensor tenosynovitis. It is irritation of the extensor tendons located at the dorsum of the hand and wrist. Ulnar wrist pain is very difficult to diagnose due to complex anatomy and biomechanics. Triangular fibrocartilage, TFCC. Triangular fibrocartilage complex works as a cushion that stabilizes the wrist joint on the ulnar side. Injury or degeneration of the TFCC can lead to wrist sprain or a very disabling wrist condition. Symptoms of TFCC tear includes swelling, clicking, snapping, cracking, and weakness. Diagnosis includes physical examination, MRI, and wrist arthroscopy. Treatment includes anti-inflammatory, physical therapy, injections, debridement, or repair of a complex tear. Extensor carpi ulnaris, subluxation or inflammation. Snapping of that tendon is a condition due to the extensor carpi ulnaris tendon is sliding in and out of its groove. This snapping over the bone at the wrist is rotated will cause tendonitis and pain in the ulnar side of the wrist. Distal radioulnar joint, arthritis or trauma. Pain may occur from various sources such as repetitive injury or previous trauma. Finally, global wrist pain, usually from arthritis, either degenerative or inflammatory. The degenerative is usually post-traumatic. All my videos and this video is for educational purposes only. Please consult your doctor before you make any decision about your medical care.